Welcome back to Leading Under Pressure. I'm Carmel Brown, founder and behavioral strategist at Nuvanti Consulting. So today, guys, I want to talk about something that I believe will fundamentally change how companies think about people, performance, and leadership. The title of today's episode is The Future of Mental Health at Work. Why mental health is becoming a business strategy. For many years, workplace mental health was viewed primarily as a benefits issue. If employees were struggling, companies offered a employee assistance program. Ask me how I know. I've been an employee assistance counselor for years, and it's a great benefit to offer your employees. Phenomenal, should not go away, should always be a part of company benefits. If stress levels within companies were high, they might bring in a speaker. I've been that speaker on multiple occasions as a mental health professional during Mental Health Awareness Month or Suicide Awareness Month or something along those lines. If burnout increased within a company among their personnel, perhaps they would offer something such as a wellness webinar or encourage employees to maybe even take time off, depending on the company. And I have been the provider that has provided, instructed, and facilitated umpteen of those workshops and webinars for companies around the globe. While those efforts are often well-intentioned, many companies are beginning to recognize something very important. Mental health is simply not a wellness issue. Mental health is a business issue. It's a leadership issue and a culture issue. And also, we can't forget that mental health is a risk management issue within companies. And increasingly, mental health is becoming a strategy or strategic issue. The organizations or companies that understand this shift with regards to mental health in the workplace will be better positioned to attract talent, retain employees, navigate uncertainty, and sustain performance. Those that don't may find themselves continually reacting to problems that maybe they could have prevented. So let me explain what I mean. When many people hear the phrase mental health at work, they immediately think about individual employees, like a person or a handful of people that maybe have experienced or expressed their experience with mental health in the workplace. They picture someone that's experiencing stress, anxiety, depression, burnout, or emotional exhaustion. And certainly, individual well-being matters, but focusing only on the individual often causes us to miss a much bigger picture. Companies create conditions. Those conditions influence behavior, and behavior influences culture. And guess what? Culture influences outcomes. I want to repeat that because this is really important and I want you guys to get this. Organizations create conditions. Those conditions influence behavior, and behavior influences workplace culture, and culture influences outcomes. And this also could be relative to environments outside of the workplace, but we're specifically referring to the workplace here. So in other words, employee well-being does not exist independently from the environment in which people work. Think about it this way, guys. If a company has unrealistic workloads, unclear expectations, poor communication, toxic, dysfunctional, or negative leadership behaviors, chronic understaffing, which is a big deal in our society today, and constant organizational uncertainty, it should not be surprising when employees experience stress and burnout. The problem isn't always that the employees lack resilience. Sometimes it is the system itself that's producing and or perpetuating distress. And that's where I believe the future of workplace mental health is headed. Forward-thinking organizations are beginning to ask different questions instead of asking, how do we help our employees that are experiencing stress? Those forward-thinking companies are asking, what conditions in our environment are contributing to employees experiencing stress in the first place? Instead of asking, how do we reduce burnout? Those companies are asking, what aspects of our workplace culture are accelerating burnout? Instead of asking, how do we improve employee well-being? Forward-thinking companies are asking, what leadership behaviors, systems, and policies are shaping employee well-being each and every day within our company? Those are fundamentally different questions, and they produce fundamentally different solutions. One of the most significant shifts that I expect to see over the next several years in movement away from viewing mental health as an individual responsibility and toward viewing it as an organizational or company-wide responsibility. Now, to be clear, individuals are still responsible for taking care of themselves. I want to make that clear. Employees still have a role in managing stress as it relates to them maintaining boundaries and seeking support when they need it. But companies also have a responsibility in this because companies design workloads. Organizations establish expectations and they create politics and shape culture. The companies in which we work determine how leaders behave and what behaviors are rewarded. So, when companies ignore these realities, they often spend enormous amounts of money treating symptoms rather than addressing the root causes. And this brings us to leadership. If culture is shaped by behavior, then leadership behavior, and when I refer to leadership behavior, I'm referring to how the leadership, management, the superiors in an organization, how they interact with other people and how they respond to others. That's what I'm referring to when I say leadership behavior. Becomes one of the most powerful influences on workplace mental health. Employees watch the leaders within the company in which they work very closely. They observe how leaders respond to pressure, how they communicate during those moments of uncertainty, how they handle mistakes, and also how they manage conflict. They also pay attention to how management treats people when those deadlines become very tight, and whether or not they model healthy boundaries or whether or not they reward those who overwork. What are the leaders within your organization? What are they rewarding? Your employees pay attention to that. Will they create psychological safety or do they create psychological fear? In many ways, leadership behavior becomes the operating system of organizational culture. And if leadership behavior, the way that your leaders interact with and respond to situations and people within your organization, leadership behavior becomes the operating system of that culture. And if it's unhealthy, it becomes inconsistent, reactive, fear driven, and those things tend to have a ripple effect throughout your company. And this is why I believe the future of workplace mental health is inseparable from leadership development. This should be a integral, critical, essential part of leadership development within your organization, starting from onboarding all the way through separation. We're moving beyond a world where leadership is measured solely by productivity, revenue, or operational performance. Of course, those things will always be critical, very important, and at the top of the list. But increasingly, companies are recognizing that leadership behavior, the way that leaders within an organization interacts with their employees and stakeholders in the community in which they serve, and the way that they behave during moments of stress and pressure and crisis, the extent to which or how it influences retention, engagement, innovation, trust, and overall well-being within the company and amongst their employees. In other words, leadership effectiveness and employee well-being are no longer separate conversations. They are the same conversation now, increasingly. Another trend I believe we'll see is a greater focus on psychological safety within the workplace. Psychological safety is often misunderstood. Some people assume that psychological safety simply means being nice. Others assume that it means avoiding accountability. And in reality, psychological safety means creating an environment where people can speak up, they can ask questions, they can admit their mistakes, challenge ideas that may be coming from their colleagues or leaders within the organization, and share concerns without the fear of being humiliated or fear of being retaliated against. When psychological safety is low, employees become more quiet, communication decreases within the workplace, and problems remain hidden, unfortunately. Innovation tends to slow down, or sometimes, in some cases, even goes away altogether. Risk increases. When psychological safety is high, organizations become more adaptive, more resilient, and more effective. That isn't simply a people issue. That's a business issue. The future of workplace mental health will also involve a stronger focus on prevention rather than just reaction. Historically, many organizations have waited until problems become visible. An employee resigns, or several employees resign. A leader burns out, or the entire organization is burnt out. A team becomes dysfunctional because there's resignations and burnout and heavy workloads and such. Conflict escalates, absenteeism increases, performance declines. Only then, in most cases, does intervention occur within most workplaces. But the future is likely to be very different. This is what I anticipate. Organizations are becoming increasingly interested in identifying risk earlier, recognizing those warning signs much sooner than we have in the past, measuring organizational health more intentionally, and assessing leadership effectiveness more comprehensively, and creating systems that support sustainable performance before a crisis occurs, not after. And this is where mental health begins to intersect with organizational strategy. Because preventing problems is very often significantly less expensive than repairing damage after a crisis or some distressing event has occurred. I believe organizations will increasingly recognize the connection between well-being and business performance. For years, some leaders viewed mental health initiatives as soft topics. Important, perhaps, but difficult to connect to measurable outcomes. That perspective is changing. Companies are seeing clear relationships between employee well-being and retention, employee well-being and engagement, employee well-being and productivity, safety, customer experience, and organizational reputation altogether. In other words, well-being influences performance. Not because employees need to be happy all the time, but because human beings perform better when they have the resources, the support, and the necessary stability to do their best work. As we look ahead, I believe that companies that thrive will be the ones that stop asking, do we need to focus on mental health? And start to ask, how do we build systems that support healthy, sustainable performance? And that's a very different conversation. It's no longer about just offering resources. It's about creating environments where people can succeed without sacrificing themselves, their well-being, their families in the process. As we wrap up today's episode, I'd like to leave you with a final thought. The future of workplace mental health is not about creating perfect companies or organizations. There's no such thing. Every workplace will experience challenges and have flaws. Every organization will encounter pressure, uncertainty, change, and adversity. The question is not whether pressure will exist. The question is how organizations will respond to it. Do they build cultures that help people navigate pressure effectively? Do they develop leaders who remain grounded under stress and pressure? Do they create systems that support sustainable performance? Or do they unintentionally create conditions that magnify distress? And I emphasize the word unintentionally because many companies are well-intentioned but are creating conditions that magnify distress unknowingly and unintentionally. The organizations that answer those questions well will have a significant advantage in the years ahead with regards to mental health at work. Because the future of mental health at work, it's not simply about wellness, guys. It's about leadership, about culture, it's about risk, it's about performance. And ultimately, it's about creating workplaces where people and organizations can thrive together. Thank you for joining in and listening on this episode of Leading Under Pressure. Until next time, remember that sustainable performance starts with healthy people, healthy leadership, and healthy systems. Take care and lead well. I emphasize the well under pressure. I'll see you next time.